Good morning, everybody. I'm checking in to see, am I on? Can everybody hear me? Okay. I want to check in. Okay, great. I was just checking in with our technical person, making sure that everybody can hear me. But just want to welcome everybody today. Thank you for joining us for this series that we're kicking off today called Pilgrimage Through the Pandemic, a series for learning, reflection, and transformation. We are really grateful that you all are here with us today. As some of you have experienced, Durham Cares leads the Durham Pilgrimage of Pain and Hope, a journey of learning about the history of the city, hearing from community narrators who have impacted our history, and reflecting on what it means for our own lives and our spiritual journeys. And with the coronavirus, we're not able to go on this pilgrimage because we are social distancing. But what we wanted to do was take that pilgrimage methodology, that framework of deep reflection, of having a posture of listening, and of using practices like lament and hope to reflect on what does this mean for God's story? Where is God in all of this? And what does it mean for our own stories? How do we respond to this? We're really glad to be able to kick this off now. I wanted to share with you all that today, Tammy Rodman, who has done a remarkable job in organizing this and in designing this virtual pilgrimage and finding great speakers. Unfortunately, her father is in the hospital and she has to tend to her family. So she's not able to be with us today, so we can definitely keep her in our prayers and her family. So I will be filling in for her today. I'm Reynolds Chapman. I'm the Executive Director of Durham Cares. And my co-host will be Jessica Russell, a Durham Cares board member. So we will be co-hosting today. And the topic today is COVID-19. I'm thinking of the exact title, but we're looking at healthcare and research. We want to help people understand here's the title, Facts from the Frontline. Healthcare and research. So what is going on at the front line of healthcare, the front line of research? And we have a great team of panelists who are going to share with us about that. Edwina Gabriel, the Director of Nursing at the Lincoln Community Health Center, is with us. Thomas Denny, the Chief Operating Officer of the Duke Human Vaccine Institute. Serana Spalding-Markham, a geriatric nurse practitioner at UNC Hospitals. And Robin Hanes-Featherstone, Director of Student Activities and Assistant Dean of Students at North Carolina Central University, and a survivor of COVID-19. They all are with us today and will be sharing with us. So we're really grateful for everybody who's with us today. This is part of a 4-part series. So I will mention from the start that we're going to be doing this every Thursday for the next 4 weeks at 11 o'clock a.m. And also in the chat, if you have any questions, then please put them in the chat and we're going to do some Q&A afterwards. So let's go ahead and kick this off. We're going to start with Thomas Denny. He is the Chief Operating Officer of the Duke Human Vaccine Institute. And he's going to share with us a little bit about how his department has shifted, his clinic has shifted to really address what's going on right now. So Dr. Denny, could you share with us about ways that you and your team are responding to COVID-19?
Sure. Thanks for having me here today, and thanks for putting this forum together. So the Duke Human Vaccine Institute is an institute that's been around for about 30 years at Duke, and it came into its founding, if you will, in response to HIV/AIDS, and that was the challenge to come up with a vaccine to prevent AIDS. And most of us, for our careers, have been focusing on that pandemic and learning all sorts of immunologic, virologic issues, and then trying to build vaccines to prevent people from getting infected. When COVID started to appear, it is in some ways a virus similar to HIV, and it's in the same family, if you we call it's an RNA virus, which is what the HIV virus is. And we had a lot of expertise there that we could frame shift into being able to take on hopefully a leadership role. So to help deal with COVID, first in our community, and then second, obviously for the more global aspects of it. So we set out and developed a number of programs that started out from helping to onboard and provide testing. You've heard of all the information around lack of testing that's been available in the US. We brought online a PCR system that we used for HIV, but we were able to adapt it for this need. And we can test 400 samples per day, running 3 shifts a day on that platform. We then started supporting what we call clinical research, and we had a program that was led by Dr. Chris Woods at Duke, who is a program that when we identify someone that is initially positive with HIV, with COVID, we then enroll them and we look at their family members prospectively over time. So this is generally called an incidence type of study or a natural history. You're trying to learn more about the settings of transmission and then what happens in individuals as they progress with a disease. We then were able to, since we've had a strong program at looking for what we would call a countermeasure, a way to protect someone from something for HIV, we started bringing up programs that would make vaccines or monoclonal antibodies that would be useful as protection for, so monoclonal antibodies may be useful for protecting healthcare workers for short term, sort of like years ago, if you heard of a gamma globulin shot, you would get that for short term protection. It would be also good for first responders. It may also be useful for people that are in an ICU setting or having advanced disease where you want to lower the virus burden. And then we have that program's led by Greg Simpowski and Bart Hanes. And then we have another program led by Bart that is looking to develop a preventive vaccine. And then we're very fortunate at Duke is we have our own manufacturing facility. So if we are able to discover a monoclonal antibody that we think is protective or useful, or a vaccine, we have what's called a GMP, good manufacturing principles, and we can manufacture vaccine material and get that into what we call a first in human phase 1 trial, so that we can then see, is it safe, and does it develop the type of preventative responses that need to happen in people. So what we like to think of our program at the Vaccine Institute as from discovery through translation into the clinic, that we have various teams that touch all aspects of dealing with an issue. And we were able to mobilize this team to respond to COVID in the same way that we've done for flu outbreaks in the past or HIV in the past.
Thank you for sharing that. One other thing I'll ask you to share, Dr. Denny, is how hopeful, what do you see as the kind of future direction of this?
I think we're cautiously optimistic that we are going to get. I mean, just look yesterday. If you've been following the news, there's been this fantastic news that a drug that was helped to be developed many years ago, UNC, looks to have passed through a clinical trial and what we call a placebo-controlled clinical trial, and it looks like it is providing some significant effects at lowering the virus burden in people. So this would be called an antiviral. So that's a wonderful breakthrough for the field. We're also cautiously optimistic that we're going to be able to develop, or when I say we, that's the collective we, those of us in the field throughout the world that are doing this, we will be able to develop some vaccines or monoclonal antibodies that will be useful in different aspects of this disease. It is going to take some time. We're most likely not going to be there in 3 months or 6 months. So I do think we're going to have a long fall and winter, but I am cautiously optimistic by next spring that I think you'll see a few vaccines that will be close to at a level of what we call being deployable. You know, being able to manufacture them and deploy them into the field to be administered to large numbers. That is no small undertaking to get it done in that quick of time. What we have to be careful about is we know from other diseases that you can give a vaccine that can end up giving what we would just describe as a bad response to the person. In other words, it can make an antibody response that would make you potentially be more predisposed to get infected compared to protecting you. So we have to be careful as we develop these vaccines that we have adequate time to study how they interact with us and make sure that the vaccines that we bring forward are going to clearly be the ones that elicit the protective immunity and not these, if you will, these antibodies that we term them in the field as enhancing antibodies. That would not be a good thing to roll out and give to millions of people around the world.
Right. Thank you for that. Let's move on to hear from Serana Spalding-Markham. She's a geriatric nurse practitioner at UNC Hospitals. And Serana, we would love to hear from you what ways you have seen COVID-19 impacting the work that you're doing. Perhaps go ahead and unmute your microphone and your video, Serana.
I have, and there we go. Sorry, I was clicking and it didn't quite work. I think that one of the biggest issue or changes we've seen to date is the move to video visits at UNC Geriatrics. We work both on an outpatient clinic basis, and I do spend about 50% of my work week in outpatient work, and then the other 50% I work in nursing facilities with both long-term residents and people that are in subacute care. What we've seen in the outpatient is just really moving away from having the patients come in and do as much as we can remotely, both to protect the patient and the providers. At UNC Geriatrics, we pretty much had to triage providers themselves that were at risk, and then also patients, and then try to cohort them and protect them. As such, we had a very quick move to video visits, which was for everybody a very fast learn, because obviously that was something that we weren't able to do until a month or so ago. And it is actually being used. We didn't think with the older population they would really embrace it very fast, but we actually do have a lot of folks that are very quickly themselves at home learning how to log in and talk to us, and we're just seeing how technology has changed that. And then obviously for folks that don't have a computer or a smartphone, we're able to do phone call visits with them and reduce any movement around and about that they don't have to do. So I do think that's something operationally that obviously was a huge change for us on the outpatient side. On the nursing facility side, I think the biggest thing was just having the severe lockdown of the facilities that we have, which is only health professionals and those that have professional reasons for being there going in and having to be screened. And, you know, there's good and bad with that. Obviously, you feel for any of the residents in these facilities because they're not able to see their family like they used to. And there is a certain amount of isolation that does go on with that we are concerned about, and we do watch them. We've had some families that have been very innovative in how they're gonna visit with their loved ones. And the facilities have been really good about figuring out windows that could be used so that the families can stand outside and wave at their family members. So there's just been a lot of changing around how we do. I don't think from the care standpoint, you know, we still do a lot of things the same, but operationally how we go at things has changed quite a bit.
Thank you for sharing that with us. And in a little bit, we'll dig into some more details and aspects of that. So thank you very much.
Absolutely.
We'll turn now to Edwina Gabriel. Thank you very much for being with us today. He is the Director of Nursing at Lincoln Community Health Center. And share with us about how you see COVID-19 impacting your work and impacting the work of your department at Lincoln Health Center.
Can you hear me?
Oh, now we can hear you. Yep. I can't see you though. I think the video went out. Oh, there we go.
Hi, can you see me?
Yes, can see you and great.
No, hi, nice to meet you. Well, I am actually in my office at Lincoln right now, so that's where I'm having to speak to you. We have been challenged. As you know, we serve some of the highest risk, underserved, and our patients are more at risk of not coming in if they're sick. Are you able to hear me?
Yes, yes, we can hear you. Yep, thank you.
Okay.
Yep, keep on going.
So some of the, I keep losing the visual here. Some of the issues that we have very big concerns. We are being proactive in anticipating that in the community, people who have been furloughed or people who have been terminated will, after 30 days, lose health insurance. So we're expecting that we may see a large influx of new patients coming in at some point because those patients no longer will have insurance. In preparation for that, you know, we have testing station. We have a testing station here, a drive up that our current patients can come through if they're experiencing symptoms, and they're assessed by a provider by telephone. They're put into an appointment, and we can get the results fairly quickly. Some of the risks of our patients that we're concerned about is that we're anticipating that we have homebound patients. Lincoln has several vans, and we typically pick up patients. Social distancing has challenged us on how to get patients in that must come in to be seen. ER utilization is something that we still have to look at. We don't want to inundate the emergency rooms with patients who are not in need of emergency treatment. We're anticipating that that may happen, but we're trying to get ahead of it, be proactive about it, and reach out to our patients with telephone calls. Just like the Serana had said before, what we're doing is we're having phone calls, we're doing video calls with our patients. That's because of our population. What we find is that our patients may not have cell phones that are able to do video conferencing. We have patients who may have cell phones that are operating today, and tomorrow the phone is off. So we're challenged with reaching our patients. We're challenged with getting information to our patients. We're challenged with assessing our patients. We are challenged with the services that our patients need here. We have patients that are in need of mammograms, for instance, because we're an outpatient clinic. We're outpatient ambulatory care. Our patients need referrals for mammograms. Our patients need referrals for dental work, eye care. Our patients could typically come in and they can receive joint injections. We have a behavioral health clinic here, and our behavioral health, I want to just add, we have Carolyn Crowder here, Jane Crowder, our director of behavioral health, and our behavioral health team has been very, very robust in reaching out to our patients. We also have medication-assisted therapy here. We have patients that usually come in, and our patients are coming in to receive Suboxone or buprenorphine. We're trying to reach our patients so that our patients do not become casualties, that we can flatten the curve. But we have lots of concerns on this end. We have a lot of concerns. We can't predict what we'll see within the next 30 days, but those things that we know can affect the health of our patients, we're looking at those things and we're trying our best to get ahead of it so that we won't have a fallout on the other end with our patients not being able to receive the health care that they would have. We're maintaining access. Our access is still open for our patients. So in as much as possible, we're trying to make sure that we can reach them and get everything out that we can. We have food insecurities in the community that we serve in this community, in this zip code 27705, 27701. The pantries are a challenge now because when Meals on Wheels stops, we have homebound patients and seniors, which are our highest vulnerable according to the COVID, 65 and over. We have those patients that are very vulnerable and they're not getting food. So the volunteers, typically the volunteers are people who are over 65. So the volunteer supply is not there as it was. So we're looking at it from the community side of it, and we're seeing that our patients are affected, and we're preparing for our future patients.
Thank you for sharing with us. It's very striking how this has impacted all aspects of
Yes.
the community, all aspects of the healthcare system, even places that many of us would not even think about. So thank you for sharing with us those details. We're gonna turn to Robin Hanes-Featherstone, and she's gonna share with us, she has recovered from COVID-19, and we are grateful for her being with us today. And we would love for you to share with us about your journey with that. So thank you for being on.
Good morning. Excuse me. I will do a little disclaimer. I do get a little winded, so if I break just for a second to breathe, just bear with me, which is a part of my journey. I am considered recovered. Yay. I beat COVID-19, and I know that I am fortunate and blessed to be able to sit here today and talk about my journey. My journey was a long journey. I came in contact with a person during the week of March 9th on my job. I work at Shaw University in Raleigh, and a student had contracted COVID-19, but we didn't know at the time, and we had a program, planned the program on March 9th, which is the day the program took place. And on March 12th, that Thursday, I started feeling just really tired and headache that would not go away. But of course, like a lot of people, I'm not thinking COVID-19, I'm thinking allergies. I'm thinking I've contracted a cold from a student because I work with a lot of different students. So I remember sitting in a meeting. We had a staff meeting because we were planning the next day to go to all virtual activities on campus. And I just didn't feel right. And the next day, Friday the 13th, I remember so distinctively, I could not get out of the bed. My arms, my legs, everything was just hurting. There was literally not a part of my body that was not hurting. And so I'm thinking flu, pneumonia, I don't know. But I was like, okay, I'll just kind of, wait it out. And the next day, that Saturday, my girlfriend, one of my friends called me and was like, I think you need to go to urgent care, your doctor. And I was like, nah. And my husband was like, maybe you need to go. And I was still kind of like, because I have a high threshold for pain. So I went into the doctor and they asked me at the time, had I been in contact with someone? And I'm thinking at that point, no, because I still didn't know that I had been in contact with this student that week. So I'm saying, no, I haven't. I haven't been out the country. I haven't been in. So they were like, well, it looks like the end of the flu. They tested me. I had bronchitis at the time. And they gave me something for my sinuses. Well, when I got back home, I literally just was like wiped out and still could not do anything, couldn't eat. And I started feeling a little bit better a few days later. And my husband's birthday was coming. So we were trying to think of how we'd celebrate that in quarantine. But then I started feeling bad again. And then I got the call. This is now a week that I had been in contact. So I had been in contact with all these other people by this time. So shows you how it can easily spread because we didn't know I had been in contact. So at this time, I go get tested and have that lovely test that goes way up your nose. But I'm thinking still, surely I don't have it. It's just colds and allergy. And then I get the call back that I had tested positive for COVID-19 and my heart dropped. Because mentally you're thinking, now what? I'm asthmatic. I beat cancer a couple of years ago. So I'm like, now this. And I have a husband and a child at home. We have another grown child, but one at home. So now immediately I'm isolated from them. No preparation or anything. Everything stops. My little guy is being homeschooled. So everything stops because mom is the one that does the school. Now my husband has to work and try to do school and try to stay distant from me and stay healthy, but still take care of me and push food and everything towards the door and then sanitize everything. And we're in the same house on separate parts of the house. And there are some days when, you feel better and you feel like getting up. Then there's other days during this where my body was just so exhausted. I literally throwing up some days. The symptoms vary so much with people. You just don't know what's happening. I recall being sick one night and throwing up and then getting lightheaded. And my husband couldn't even come in the room to help me. So there I am. He's at the door like, I want to help because that's what I am. I'm your helpmate. I'm trying to get to you. And I'm like, no, because I'm thinking somebody has to raise this 9-year-old. So let me fight this out. So we're going through the struggles. One thing that I mentioned to him and even to others is you go to bed at night or you try to sleep and you wake up, it feels like you're drowning. You literally cannot catch your breath. And so this goes on back and forth. And then I start feeling better and the fever goes away and the health department checks every day. And then now my fever's gone and without me taking anything, any Tylenol, because that's all you could really take. I've been without a fever for the amount of days and now I'm considered recovered, but my body is still hurting and I'm still having a hard time breathing, but I'm considered recovered. And then we have a setback. I can't breathe. I can't catch my breath. So now I've avoided the hospital all this time. So I'm decided I'm not going to the hospital. I don't sleep one night for 24 hours. I'm awake. And my husband's like, you're going to have to go to the hospital. I'm refusing to go, which I hope no one else would ever do that. And then we find ourselves at Duke Hospital. And thank goodness I went because I was, and I think there's a doctor on here which will understand, I was on my way to pneumonia. I had some fluid in my lungs, but not a lot, some inflammation of my chest walls, and it explained why I could not rest. And so that was that was a couple weeks ago. And so now I am truly considered recovered. As you can tell, I do have some windedness with me, if that's a word, having to catch my breath every now and then. I like to work out and do those kind of things, but I don't have the strength to do it just yet. So I'm building up my walking. It doesn't sound like a lot, but I walked like almost 3,000 steps the other day. And for me, that was like, yay, and did not pass out. I didn't feel lightheaded. So I share my story and say all that to say social distancing, following what the mandates are, knowing your body is important as well. And just doing what we have to do to get through this. Like I said, I'm grateful. My husband and I both have family in New York, and we both lost family members. It's just one of those things where I'm trying not to get emotional because I'm here. And you see all the stories of people that are not here. And to be able to sit and talk about it and to share with others so that we can find out what's going on, flatten the curve, do what we need to do. I don't mind staying at home. I don't mind being here right now because I can be here later. So that, in a nutshell, is my story.
Wow, I don't mind being here right now because I want to be here later. Robin, thank you. Oh, gosh, I am sitting over here with goosebumps and tears in my eyes. Panelists, thank you so much for sharing a little bit of your context and story. My name is Jessica Russell. J. Russ is what everybody calls me. And we're going to start and kind of transition into the Q&A portion of our panel. So for everyone who is on Zoom, you can go to the little button that says Q&A, and we'd love to hear your questions for our panelists. We've got so many incredible stories that we would love to dive a little deeper. But I'd like to start off, if anyone who is joining after Reynolds just did an opening, Durham Cares is really known for the pilgrimages that they do in Durham locally. And it's a weekend where we focus on the story of Durham and how it intersects with our story and God's story. And it's a lot of focus on pain and hope and holding that tension. And so we're really, since we can't physically go together on pilgrims throughout Durham, which we hope to do soon, hopefully, and would love for anyone here to join us, we really want to focus on a digital version of what this looks like in the pandemic. So Robin, I'd love to start off with you and just ask, a lot of the, let's bring Robin back. Oh, did she disappear? Well, we can, Edwina, why don't we jump over to you while we get Robin back? If we could pull up Edwina's video, and I'd love to hear from your seat. I mean, you are on the ground. You're getting the chance to both wrestle with how we're planning, how we're thinking. We're talking about the most vulnerable people in our community. Can you tell us a little bit about where you see places for lament and where you see places for hope in the work that you're doing on a daily basis?
Well, the hope that I see is in the faces of the children. The world, as adults, we see the world differently, but the children, it's still just a nice place to be. They don't feel the threat. They're not looking at what are we going to eat next month. They're not looking at the things that the adults, the children, when they come into Lincoln, we have a pediatric clinic here. It's life as usual when you see the children. I see the hope in the faces. I mentioned to someone the other day, what I miss a lot are full faces. The full face, because we're all masked. As soon as I walk out of here, I have to have a mask on. So we're learning to look at the eyes, and we're learning to read the eyes and see. That gives me hope that we've missed that in the past. We started relying on some other things, and now to me, we're relying more on the things that are important. My personal journey, I talked to Tammy and I said, my personal journey, I was taking chemo during the beginning of the COVID. And at that moment, I was feeling so vulnerable. I was coming to the end. I've not even had the chance to celebrate it yet, because the very end of it was walking into COVID. But the hope is that I look back and I said, for 14 months, 20 rounds of chemo, 20 rounds of radiation and surgeries, I'm here. There's no way I'm going to look at COVID and see that as the end. So the hope is just getting through and knowing that there's more ahead of me. There's still so much more ahead of me. So even in Durham, I see the hope. I see the hope. And how we adjusted as humans, how we adjusted. We were frightened at first. We didn't know what to do. And then we started venturing just a little bit. And we said, let's venture and be 6 feet apart. Let's venture, but let's have a mask on. But we can venture out. So I believe, I'm a half full person. I believe that we're going to rebound from this. I really believe it. I just believe it just shook us off guard. We just got a little off guard on it. So I look at what's going on in Lincoln. And the first thought when it first hit, we were like, what do we do with our homeless people? What do you do with people who have no home, nowhere to stay? What do you do with people who are in shelters and they're less than 6 feet apart? Just dealing with the highly vulnerable. I can tell you, I don't complain. Just like Ms. Featherstone said, I'll just comply. If it means that I'm not going to infect somebody else, if it means even if I'm okay, I don't know if I'm a carrier. If it means that I can help my neighbor, who's my neighbor is whoever I'm coming up to. I don't want to do any harm to them. I don't want to harm them. So I smile at our patients. They come in and they're complying as best they can. Where can they get masks? You can't afford food. You know, every time I see the news and they're saying, get your masks and do this, I'm like, but our people can't afford the masks. What do you do when you can't afford a mask? Well, just put something over your face. But what if that's all they have? You know, so it just helps me to balance my thinking and to be appreciative. And in that, I find hope. I just believe. I do. I believe.
Well, I want to create a little moment of celebration about chemo. Yes. I am a survivor. Yes. Well, Robin, Edwina, thank you so much. Robin, one of the things that really stood out to me in hearing your story that was actually featured on ABC was you said that there are so few stories of hope, you know, so you wanted to share your story because you're a survivor. So I'd love to hear from you. One of the questions that comes up a lot during our pilgrimage conversations is whose story in Durham is being told and whose story isn't being told. I'd love your thoughts there of how you might think about that information as we journey through this pandemic season.
I'm sorry, I don't know what happened.
Oh, no worries. We were just curious. You had shared your story on the news and said that you were interested in sharing because so few stories of hope were being shared. So we'd love to hear just your thoughts about, you know, whose story is being told in this conversation around the pandemic and whose story is not being told.
Yeah, it's funny because honestly, I don't know how they found me, but okay. So, but the reporter, I will never forget him, Josh, contacted me, and he was saying, and I think I do kind of know how, because we know someone who works there. I think that may be it now that I think about it. But Josh was saying that, like the previous panelist was saying, how it's affecting our community, you know, people of color. And that's was one of the reasons why they contacted me. And I was like, well, I don't want to talk about it. And I'll be honest, I didn't want to talk about it because, you know, since then, a few people have, you know, seen me even, you know, just like walking and are like, oh, you have COVID, you know, and so it's kind of like a pushback. So I didn't want to talk about it at first, but then I realized that we need to hear that there is hope. We need to hear that you can do what you're supposed to do, that there are people that are surviving. COVID is not the end for everybody. I think a lot of mine is faith. A whole lot of mine is faith, my connection to God. I trust God, kind of like I think is Edwina, I think said just now, you know, God has not brought me through all of this for me to come to this point and then COVID be the end. So never did I think that COVID was going to take my life. I never thought that. You know, it's just my mindset. But wanted to share after connecting with the television station, connecting with me, then I was like, you know, people need to hear the positive that's coming out of this, to hear that we're gonna come out of this. Yeah, there are a lot of people, my heart just dropped when she was saying how do you get a mask if you can't afford a mask or food or somewhere to stay, you know, just those things. And it makes you really think, and it makes me think how blessed I am, because I have all those things. But to share and to make sure people understand, I may have all those things and I have a comfortable home and a loving husband and family, but there are people that look like me that don't. There are people that live in Durham, that live in Raleigh, that live in North Carolina that don't. It's funny this says Durham Cares because one day during my isolation, I was sitting looking out the window and was just looking in the yard, and I was like, oh, my yard needs cutting. And my husband's, they're quarantined too. So, you know, we're like, oh, what in the world? And our neighbors in our neighborhood all came together and manicured our yard. And that lets you know how Durham really cares. You know, you hear people talk about Durham, but I'm like, who else does that? You know, and then we look up and there's meals on the porch. There's, you know, we just one day, my husband's like, I'm so overwhelmed. Every time I turn around, the doorbell's ringing, you know, it's something. And this was before the news. This was before that. This was just people caring. And so, yeah, it's just wanting to make sure people know that people do care, there is hope, and that we're going to get through this.
Edwina and Robin, thank you so much for sharing. We've got some follow-up questions that are coming through, and I'd love to get to hear from Serana. Could you share a little bit about where you see places for lament and where you see places for hope in the work that you're a part of?
Certainly. I think that my place of lament is also my place of hope. Being in UNC Geriatrics, what a lot of times in most of the larger institutions, geriatrics is also home to hospice. And at UNC Geriatrics, we also have a subdivision, which is our hospice division. And I think one story that's not being told is the fact that people are still sick from other diseases. They're still dying of other diseases in this pandemic. And it is our team that helps people in hospice position. And there are still people out there in hospice for other reasons. Yes, we do have folks that are on hospice because of COVID, but the vast majority of our hospice folks are there for other reasons. One of the biggest laments and sadness I have is that for those folks that aren't able to stay at home on hospice, that are in some sort of a facility, because of the visitation rules, a lot of them are not able to see their family towards the end of their life. And I think it's one of the things that is taking an emotional toll on providers, is that we are unable to allow folks to be with their loved ones at the end. So that's kind of a big lament, but I see a big hope in the fact that the providers are working really hard to find inventive ways to try and connect families. I've seen folks use their phones and take them in so that someone can see their son. I've seen one doctor stay late at night to try and get a hospice patient discharged to home because his wife had said, I want to hold his hand when he dies. And so the biggest hope that I see is the human factor, is that so many people have shown a lot of flexibility, both families who are understanding of the position we've had to take, and yet being flexible to say, what can we do to respect social distancing and respect quarantine, but at the same time to support people at the end of life. And I think that's a story that's not being talked about. People are forgetting to some extent that that's going on, but hospice has been very affected by the quarantine.
Yeah, sorry, yep. I have a similar story. My brother's new wife, his mom has been sick for a long time, and she passed away during the season, not related to COVID, and just figuring out what it looks like to allow people to honor her life without physically being able to be there. Inventive, but so difficult. Thank you for sharing.
You're welcome.
Dr. Denny, I'd love to hear from you in the research that you're doing and what you're seeing. I know that you're a part of a lot of different news conversations as it relates to Durham and you know, the work that you've been a part of. Whose story is being told and whose story isn't being told?
Well, first, let me just say, very moving stories that all the participants have said. And the first thing I'd say, one of the interesting analogies or comparisons for me is I've spent most of my working world in doing HIV work for the last 30, 35 years. And, you know, and traveled around the world, all through Africa, and seen pain and suffering, you know, in a lot of places. And from the early HIV days, you clearly had disadvantaged and people that, you know, pain and suffering and access to care issues. And we're just seeing all that again 35 years later with another pandemic. So some things change, some things don't. Having said that, I do think there are times like this that brings out the best of people. And we're seeing parts of that with this pandemic. The inspiration for me is that, you know, there are so many hardworking people trying to beat this, and it's a war mentality you have to be in. And when you're up against a war, you bring everything to it that you have, and you try to make something work to win the battle. You see that, you know, in every aspect of people that are dealing with this. You see it first with the patients and their families. You see it with the first responders, you see it with the care providers, and from my perspective, you see it from those of us that are trying to come up with vaccines or figure out better ways to do testing that we can more quickly identify who's infected. And you know, someone was talking about, you know, there's one about recovering from cancer. Well, in the cancer field, it's very common that when you're first diagnosed, you go through a battery of tests to be what's called staged. So we can just sort of understand, is it early, is it mid, or is it a late stage of a disease? These are all things we have to learn yet with COVID. And if we could learn those things early on, what's a predictor of someone that will need to go to ICU versus a predictor that someone's going to be uncomfortable, but they will be able to stay home? If we can understand what type of tests or markers, as we call them, predict that, then we can help manage this disease a lot better. But you know, I point out to people, you know, if you look at cancer, if you look at other disease processes, we've had years and years of experience coming up with ways to deal with it. COVID, we're only dealing with this now 4 months. So when you think of where we've come, we've had a lot of problems and a lot of challenges, but you think at where we've come in 4 months, it's an amazing journey so far that we've made it to be able to do the things we're doing, and not just in a local area. This is global. There's not one place that this is not going to affect. So and I give the analogy of, you know, when the car was first designed and built and rolled out, you had a lot of years to do that. And when you rolled it out, you didn't roll it out to 500 million people across the world on day one. And that's what you're really tasked to do here. You're to discover something, manufacture it, a vaccine or a drug, and make it available to everyone around the world. That is an enormous task to be done in a short period of time.
Thank you for sharing. There are a number of curious people wondering how faith communities can support the work that health centers are doing, like yours, Edwina, at Lincoln, without adding organizational burdens. Are there specific ways that people here and in the community can support you and not add to the plate that you have that's full?
Can you hear me?
We can, yep.
Well, we have beautiful, Ms. Featherstone was talking about, I call them the random acts of kindness. We have had the community, we're about 4 blocks from North Carolina Central. We've had the Community Cares Network of North Carolina. We've had people bringing in masks, the shields that they've made, 3D shields. We've had people, and because we have a supply, we hand them to patients, we give them to patients, so patients can have, you know, if a shield is better than nothing. We have them bringing food. We were served lunch yesterday by one organization, because when we're here in the building, as you know, you're not going to just trolley around Durham trying to find food. It's a difficult task, and then you want to keep contact to a minimum because we go home. And we've had some positive diagnoses here, not employees, but with patients. So you want to limit your contact as much as possible. But the community has always rallied around Lincoln. And I think that's just our relationship, in that they know that Lincoln rallies around the community. Now, the faith-based, what I know is a good thing is we're in gardening season. We have lots of community gardens popping up now, and that's a nice, safe place for people to start picking up peppers and picking up, well, potatoes aren't out yet, but, you know, start to pick up the first items. Like I said, our bigger challenge would be the people that are homebound, because Meals on Wheels is not operating. The community has been very good about helping the community. They've been very, very good about it, and we've seen it.
Edwina, for those in our community who might not be as engaged with people who, have less and have less resources, are there ways that you know of that, people can get connected in that way to figure out who needs help?
Yes. The food bank, you have the food bank of, the food bank of Central Eastern North Carolina. We have In Hunger Durham with Betsy Kreitz. We have, those are the main 2. And when you go to, there are churches that have food banks in them, food pantries in them. There's a list. Our caseworkers here, our behavioral health department here, I had mentioned the name Jane Crowder. Jane, her motto is, there's no wrong way to behavioral health. There's no wrong way. You can come into the door, we'll test your temperature, get you in. We have a WIC department here for our babies to get food. But when you come in, there's lists, and the list will tell you where there are places that are giving out food.
Wonderful.
One of the shortcomings is you have to be able to get here. So the homebound, so we still have the issue with the homebound, but our behavioral health department also calls our patients. those patients that are high risk, they've been calling them, checking on them, making sure that they are mentally and emotionally tolerating staying at home. Home is not always a pleasant place for people. I'm like Ms. Featherstone. Lock me in at home, I'm okay. But for some people, it may not be safe. For some people, for some of the children, it's not. So we have people here at Lincoln that are literally calling those high-risk people and checking in on them. And over the phone, what they'll do is if they're having issues with food insecurity, if they're having problems, they are still connecting them through the community to make sure that we're not going to lose people through the gaps. We don't want to lose them.
Amen. There have been a couple questions that have come up about homelessness, and we are actually going to be this is one of 4 panels that we've got set up. And so we're going to be talking about homelessness in a few weeks, homelessness and food insecurities. So we'd love to have you guys join. I think Rendell's is going to go over that. But we also have a poll that's getting ready to populate. So as that's getting ready from our team, I'd love to ask for our panelists, if you are interested or willing or have any connections to places you'd like to support or people were interested in contacting you, if you could just put your information in the chat function. If you wanted people to connect with you on LinkedIn, or you've got an email or a food bank or something like that that you'd like to support, feel free to put that information below in the chat feature. And there's a poll that's popping up. We've got 4 series already set up. You can see all that information on our Facebook page. And they'll all be Zooms like this with amazing speakers like the ones we've had today. But we'd love to know if there are other conversations that aren't being addressed in our current series. And so we'd love to get your feedback there. And then I'm going to pass it off to Reynolds to share some additional pieces.
Great. Oh, thank you all. I didn't realize until the video went on how crazy my hair is right now. This is what happens when you're in quarantine. But just grateful for everybody who shared with us today. For all our panelists, your sharing was really valuable. And thank you for all of our guests, for everybody who was able to participate today, and for your good questions. We, as Jessica said, we are going to continue this series. We're going to have the next one will be next week at 11 a.m. and we're going to look at policy. And we have some great panelists. Learn more on our Facebook page. And after that, we'll look at how how COVID-19 and racism are interrelated and what's happening right now. And we'll have some great panelists on that. And then the following week, we're going to look at local ways of addressing what's going on. So really grateful for the upcoming events, and we hope you will be a part of it. And if anybody wants to support this work, you can go to durhamcares.networkforgood.com and help us to continue to make this possible. We appreciate your generosity and support. So thank you for everybody. Tell your friends about this series. We want to share this. Tell people in your congregations, in your workplaces. Share the word. We have lots of space for people to register for it. So we hope that many people can benefit from this journey. So thanks again for everybody who was able to be a part of this, and we pray blessings on you going forward. Thank you.